Hi guys, welcome to my channel. I'm Jo.
And I'm Atayan.
And this is another episode of Gynae Corner, where we discuss women's health issues with my resident OBGYN.
Hello.
So, in today's episode or series or whatever this is...
What is the topic for today?
We are going to be discussing fibroids. I'm going to ask questions that you perhaps haven't been able to ask or would just like to ask your resident OBGYN, and we have our resident OBGYN right here who will be enlightening us as we go along. Don't forget to subscribe to my channel, send in any questions that you'd like us to cover, any topics you'd like us to cover, and we will try and keep this as interactive as possible. So let's get into it. Right. So fibroids. Fibroids is something that I didn't really know about until some people in my life started getting them, and I was like, what is this thing? Like, it, to me, all I know about it is that it is very painful, causes heavy periods, sometimes regular periods, and in some cases you end up needing surgery to get them out, depending on how big they are and how they affect your standard of living. But that's a very layman understanding. So can you explain to me what exactly are fibroids? Why do they grow? Where are they from? What causes them?
Well, I mean, to be honest, with the summary you've given, we can just stop now. That's about everything.
Dr. Mrs.
Okay. So a fibroid essentially is benign, which means it's non-cancerous.
Okay.
So whilst it's still called a tumor, tumor just essentially means a growth of the uterus. So essentially the uterus, which is the womb, has three layers. The kind of outer layer, which sits on the inside of your tummy. Then there's the muscle layer. And then there's the inner layer called the endometrium, which is the lining of the womb that you shed when you're having a period. A fibroid is an overgrowth from the muscle layer, essentially of a muscle cell and some fibrous tissue that grows from there and can get bigger over time. They're mainly under the influence of hormones, mainly estrogen, which is secreted obviously by the woman throughout your reproductive life cycle, and which is why we also find that when a woman goes through menopause and stops producing estrogen, then fibroids tend to shrink.
Right, okay. So what causes these abnormal estrogen levels, or what exactly makes that grow?
Okay, so it's not abnormal estrogen levels per se, okay. But as to what causes fibroids to grow, we don't really know what exactly causes fibroids to grow. So there is no sort of one triggering factor. There are some certain risk factors. For instance, women who are overweight, because there is more estrogen in those women, sometimes are more prone to developing fibroids. Also, we also know that certain ethnicities are at more risk of developing fibroids. But as to what the specific thing that causes fibroids to grow, unfortunately, we just don't have those answers at the moment.
Right. So what are the symptoms of fibroids? How will someone know that they've got it?
Okay, well, I think you've already mentioned a bit of it. So the symptoms of fibroids include what we call pressure symptoms. So if you've got a really big fibroid in your womb, which is in your pelvis, then that can cause pressure on your bladder, so you can have increased frequency of urine needing to pee all the time. It can actually stop you from being able to open your bowel, so it can lead to constipation. It can lead to bloating, a feeling of pain in your tummy or in your lower back. But if it's not that big, then mainly the symptoms you get are related to heavy bleeding. Sometimes it can have issues with fertility, just depending on the position of the fibroids.
Right, okay. So there's two things I want to touch on actually. Earlier you mentioned it affects certain ethnicities more than others. Mm-hmm. Is there any science or reason behind why it affects black women more than some other ethnicities?
The short answer is no. We don't know the answer, but we do know that there is that evidence to say that black women are affected more than white counterparts. The general consensus that is, again, contributory factors ranging from things like there must be a genetic component to it. There have been some studies to suggest that lower vitamin D levels might affect the development of fibroids. And the one that is, to me, the most out there is to do with hair relaxer. And there was a study that showed that women who had had longer exposure to hair relaxer were actually more prone to having larger fibroids with more severe symptoms.
Wow.
Whether or not that, I don't know whether that is reproducible in another study, but that's just some of the information that's out there.
Right, okay. So then the other thing was that you touched on fertility. How do fibroids, whether even if they're small fibroids, how can they impact your likelihood of getting pregnant, and what does that mean even for your pregnancy?
Okay, so with regards to impact on fertility, whether that's getting pregnant or whilst you are pregnant, it depends on where the fibroids are and how big the fibroids are. So a fibroid can actually impact on the womb cavity, which is the inside of the womb. So if the fibroid is pressing on the inside of the womb, then that can actually affect you getting pregnant. And sometimes you have the fibroids sort of hanging off the lining of the womb itself. And so that in itself affects the actual space where the baby can sit in. And so in that way, that will impact on fertility itself. Now, if the fibroids aren't affecting that cavity, and are situated elsewhere in the womb, that's less likely to have an impact on the actual fertility, although sometimes just their presence can impact on the ability of the womb to sort of take a pregnancy, if you will. When a woman is pregnant with fibroids, one of the main things that fibroids can cause is bleeding after the baby is born, so it doesn't allow the womb to contract down very much, so you're more at higher risk of bleeding heavily. Also, depending on the position of the fibroids, it can actually affect whether you're able to have a vaginal birth or require a cesarean section. So sometimes the fibroids can be quite low down, close to the cervix, and that would mean that it stops the baby's head from coming down. And so in that case, you might require a cesarean section. So there's no hard and fast rule as to how a fibroid might affect your fertility. It's all depending on individual circumstances and where exactly the fibroid is situated.
Okay. And also on that, can that affect like the size of your baby, for instance? Let's say, because obviously if the fibroid's in the womb, I imagine it's competing for space with the child. Does that have any kind of impact on the child's development or growth or anything like that?
Yes, it can do, but again, it depends on the size of the fibroid. So generally speaking, a fibroid that would be large enough to affect that would probably have been identified prior to finding out that you were pregnant. And so that discussion would have been had with your gynecologist as to what is the best plan, whether to think about dealing with that before or after pregnancy.
I see. Okay, right. Now, moving on, how are fibroids treated?
Well, again, as is a recurring theme, it just depends on what the symptoms are.
Okay.
Well, if we take a step back to actually how fibroids are discovered, so if a woman who has these symptoms presents to the GP and then to the gynecologist, usually what would happen would be an examination. So it depends if the fibroid is large enough and can be felt on examination. If not, then imaging will be performed. So that's usually starting with an ultrasound scan and then sometimes an MRI scan.
Okay.
Now, this will tell us where the fibroids are and what size, okay? And again, it would depend on what symptoms we're trying to treat. So the fact that a woman has fibroids doesn't mean she necessarily needs any treatment.
Right.
Sometimes fibroids are just found incidentally. You have a scan for one thing, and then we find that you have fibroids, but you didn't have any symptoms, so we don't necessarily need to treat the fibroids.
If we don't treat it, will it continue to grow?
So they could continue to grow. It depends on each person's individual circumstance. They can continue to grow over the life cycle up until menopause, because as we mentioned before, they are under the influence of estrogen mainly, and so will then start to shrink once those estrogen levels naturally go down after the menopause.
Okay, so anyway, back to the treatment.
Okay.
Yeah.
So as we mentioned, it depends on what exactly we're trying to treat. So if it's a situation with heavy menstrual bleeding, so you're getting a lot of bleeding, one of the first lines would be trying to manage the bleeding, and that's generally with hormonal contraception.
Okay.
And so that would just be used to help regulate the bleeding. And so there are different forms of hormonal contraception, and that again, depending on the person's individual circumstances, that will be discussed with them. So that's one of the treatments. And again, depending on the size and the position of the fibroids, then the next things that can be used are things like surgery. So surgery, generally speaking, is either to remove the fibroid itself. So if the fibroid is close enough to the lining of the womb, then you can do that with a procedure called hysteroscopy, where you go in from the cervix inside and take out the fibroid that way.
Okay.
you can do a myomectomy, which is just basically removing the fibroid. Okay, now that can be done either by keyhole surgery or open surgery.
What are the difference between? So what are those? We don't know nothing about surgery.
Well,
here.
keyhole surgery
Is a key in a hole.
is keyhole surgery. So essentially, what that means is we use small cuts. Okay. So usually there's a cut in the belly button that's probably about 1.5 centimeters at most.
Okay.
And then a number of other smaller cuts on the tummy.
Yeah.
Which are usually about 1 centimeter. And that's how you do the operation. And in that, once you take out the fibroid, then essentially it was something called morcellation is done, which is basically grinding up the fibroids into a very fine substance that can then be removed just through those small ports.
Right.
But open surgery, if the fibroid is quite big, then actually you might need a cut across your tummy in order to get the fibroid out. Right.
And also, what's a myomectomy? Because you mentioned that.
So a myomectomy is the medical name for removing a fibroid from the womb.
Okay. Gotcha.
So with those operations, generally those are performed in a woman who wants to keep her womb for fertility reasons. If a woman, say, is having really heavy bleeding and has tried other like medications, and feels her family is complete, then something that can be done is a hysterectomy, where we remove the womb and the cervix, and therefore remove the fibroids as well.
Right. Okay. So we've covered what fibroids are,
Yep.
how they're treated, what else?
Symptoms.
The symptoms as well.
Mm-hmm.
So what can people do to avoid them growing?
Well, unfortunately, there's nothing specific you can do to sort of prevent or avoid fibroids. However, what can have a positive impact is early detection.
Okay.
So if you do think that, for instance, your periods have changed, or your periods are particularly heavy, if you're feeling quite drained after them, or you started getting some bloating symptoms, you're feeling pressure symptoms, then these are the kind of things to look out for, and then discuss with your doctor. And so the sooner they're found, the earlier you can get treatment, depending on what your individual symptoms are and circumstances are.
Okay, fantastic. So thank you very much. That's been really useful information. We hope that it has been useful for yourselves as well. And so that kind of wraps it up for this video. As usual, please don't forget to subscribe, like, and share this video with people, and let us know any topics that you want us to cover. Comment down below any questions that you have, and we will do our best to answer them. Until next time, thank you very much for joining our video, and we'll see you in our next one. Bye.
Bye.